Hi viewers, I'm Dr. Sangeetha Mahesh, working as clinical reader at the Department of Clinical Services, All India Institute of Speech and Hearing, Manasa Gangotri, Mysuru. I hope all of you are safe and healthy. Stay home, stay safe. Today I'm here to give a brief overview about stuttering. Stuttering is a speech disorder characterized by disruptions in the normal flow of speech. About 1% of adults and 5% of children stutter. Stuttering is generally seen during childhood, and the onset of stuttering is anywhere between 2 to 5 years of age. Let us move on to the characteristic features of stuttering. The prominent feature of stuttering is repetition, where the speech sound gets repeated again and again. As you see in this example, k for the word come. The next prominent feature is prolongation, where the speech sound gets extended for longer duration. As you see in this example, sometimes. The third prominent feature is a block, where the speech sound gets stuck and no speech comes out. There are other characteristic features of stuttering, and they include excessive muscular tension, the other behaviors like the eye blinking, eyebrow raising, movement of extremities, shivering, increased heartbeat. Persons who stutter can be very much anxious and also tensed. Also, they can exhibit abnormal breathing pattern. What are the causes for stuttering? It is multifactorial in nature. Multiple factors play a role in case of stuttering. We know speech is a complex process. It involves the coordination of nervous system, respiratory system, phonatory system, and the articulatory system. Stuttering is found when there is a mismatch between the timing domain of these speech subsystems, that is, the selection, programming, and the production of speech sound is affected. It is seen that 30 to 70% of the time it can be genetic in nature. Let's have a look at this picture in detail about stuttering. Now what we see in the person is only 1/4. As you see here in the picture, so only 1/4 of the iceberg is visible, which means that 1/4 of the person is visible. That is the visible difficulties of stuttering. The negative behaviors of the person would be like fear, confusion, shame, isolation, guilt, anxiety, hopelessness, and so on. So how do we manage stuttering? There are no instant miracle cure for stuttering. The only option is to attend speech therapy. Early identification and early intervention would aid the person to establish fluency. So establishment of fluency would include focusing on relaxation, slow rate, soft contact of articulators. We can also use instrument to establish fluency in persons who stutter. Various analogies can be used to make them understand the concepts of fluency and stuttering. It is also important that we work on the anxiety, tension in the person who stutter, thereby improving the overall quality of life of persons who stutter. Let me brief you about do's for the parents of children who stutter. Help the child to feel there is no hurry to finish speaking, that is, encourage to use more pauses. Help the child to keep the language simple by using short sentences. Help the child to develop confidence. Use normal eye contact. Use as much group singing, group speaking, group reading as possible, since the difficulty in speech reduces in such situations. Be patient, try to understand the child. Now, the don'ts for parents of children who stutter. Avoid treating them differently. Avoid comparing them with the peer group and siblings. Avoid talking for the child. Give them the opportunity to speak. Avoid direct corrections, that is, you speak slowly. This will enable the child to understand that the child also has to speak slow. So you have to be a good role model for speaking fluently. Avoid speaking complex sentences with high vocabulary. Avoid pressurizing him to speak something which he is not capable of. Let's work together as a team, and the team would constitute of persons who stutter, professionals, family members, self-help group and public. So this would enable the person who stutters to be a successful individual. All things are possible for the one who believes. For further details, contact All India Institute of Speech and Hearing, Manasa Gangotri, Mysuru. Thank you.